viewers. Good evening, everybody. This is 10th of December. And as 10th goes, it is the turn of the Imaging Science Committee. And me, as a chairperson of the Imaging Science Committee, bring forth to you yet another podcast. Before we go on to introduce the celebrated guest, I have the pleasure and privilege to welcome my dear president and my dear friend, Dr. Sunita Tandulwadkar, who's youthful in her energy, youthful at heart. And amazingly, I cannot count the 16 projects that she has not just touched, initiated, but given new life to the projects through her Foxy campaign. So welcome, Dr. Sunita. I don't think I'll
Thank you.
spend time,
No. Thank you,
describing your
Nina.
energy. It's
Thank
always
you.
a pleasure to have you to take us in this yet another podcast of the Foxy Gyan Pravah. Welcome.
Thank you, Nina. Thank you. And you are one of my favorite chairperson. You know that. The best friend. So I still remember the initial days when you used to call me ma'am. I said, I'm same Sunita, which years of a friendship. Nina, you are doing such a great job as a chairperson. You are very methodical. Having the responsibility of the head of the department of AIMS is I know AIMS head, what is the responsibility? It's not just running the department, it's working simultaneously with the government on every A, B, C, D, E. So you are doing amazing. Means I think at a very young age you have become a HOD, and you probably will be for a longer period. You will be shining and taking the maternal health to another level. And what is most important, Nina, you can combine the government, the Foxy, the maternal health, and everything. Now, since you have a imaging science as a committee chairperson, you are putting your 100%, your workshops, you are traveling, and I'm so glad with your project. I just want to tell you, whatever the projects and the module, if you send, we will be combining in our Connect. I'll forget to give you a call again, so please compile it, and if 2-3 days, send it to us. Dr. Gauri Devi, thank you so much for coming on a Foxy platform. We always meet in infertility platforms, but sometimes it's nice to be on a Foxy platform. These are 8 p.m. podcast series we run for last, I think today is a 316th podcast. This is, I think, na bhuto na bhavishyati. Even if I think of doing this in ISAR, it's not possible because these are my 30 dedicated chairperson who have taken over 30 days. I joined 8 p.m. just to welcome the faculty and show the respect from the Foxy whole team for spending your valuable time and being with us for 1 hour. Thank you so much. Our protocol says I join the viewer links and you and Nina will have a beautiful dialogue with each other. Thank you.
Thank you,
Thank you,
Dr.
Sunita. Thank you so much. So,
Thank
thank you, Sunita. And let's get back to our podcast. I think it's indeed a pleasure and an honor to welcome a very charismatic, good looking, beautiful, and a very youthful lady, I think, who's a mentor, role model to many, including me. And I take the pleasure of introducing ma'am, Dr. Gauri Devi. The beautiful Dr. Gauri Devi, I think, is needing no introduction to this audience, but I will do the honors by saying that she's the director of the Gauri Hospital Limited. She's the director of the Ridge IVF Group. And to tell the viewers, she's one of the pioneers to start infertility and IVF services in the northern India, Delhi. Coming from Kerala, working in Delhi, doing her post-graduation from the prestigious Safdarjung Hospital, she had a mission at her, in her mind, and the igniting brainy woman left no stone unturned from her obstetric busy practice. She has taken infertility to next frontiers. She has been the president to many bodies. She's been the past president of the Indian Fertility Society. She has been the vice president in the past for the very big organization NARCHI. She is now the president-elect of the Fertility Preservation Society of India. So you can see what is her passion that drives her to all these posts. Not to forget, she has been on the executive board of the AOGD, which is the Association of Obstetrician and Gynecologists of Delhi. And she has been there since 1994 in many, many, responsible positions. Quality is her is her forte, and she's been the State Quality Assurance Committee member for the government of Delhi. She's also been the advisory member for many committees for the Delhi government. And to name a few awards, she's the recipient of the Kanak Goyal Award from the Indian Medical Association. She's got the Chairperson's Appreciation Award from the IMA. She is also the recipient of the APJ Abdul Kalam Excellent Award and has been named by the Economic Times and many times by many, enterprising, I would say, media houses as the enterprising obstetrician for many years. So welcome, Dr. Gauri. I think if I start completing your CV, I'll not be able to sort of run. So I think I've chosen a topic which is very pertinent for present day. So welcome you once again.
Thank you, Dr.
So
Neena.
yeah,
I'm
so
really grateful to Foxy, Dr. Sunita, as well as Dr. Neena, who is a very dear friend at the moment, who is the chair of Imaging Committee. And I'm really thankful for inviting me to this platform.
So I think we'll have a very casual podcast, as I would say. We know that you have got loads of experience. I would say more than 3 decades into the fertility practice. Am I right, ma'am? And I
Yeah,
think if I would say you have delivered 3 generations
yeah,
as an obstetrician, and
true.
now I would say 3 decades of,
Yeah.
or more than 3 decades. So, I would just say, how would you perceive this, in your career, in your, growing in science, that we evolving with technology, we are an intersection of so many things. How do you have seen your practice when you started way back in the early 90s, I would say 92 to 93, when you were sort of gearing up, and when very few of us actually knew what IVF or test tube baby was.
True,
And
true.
today, when you are leading the Gauri, group, the Ridge IVF, which has got a chain of IVF units, how do you perceive yourself? And then we'll come to the shift. How to see yourself, as
Okay, let me take you a little way back. You are talking about 90s. Let me
yeah.
take you way back to 70s. I was a registrar in Subjung Hospital and I used to run the infertility clinic. That's how my passion for infertility came in. There was nothing, Nina. Semen analysis, azoospermia, you can't do anything.
Mhm.
And the men always blame the women. And the man goes and marries again. The woman is crying. We can't help. He goes and gets married again because the women is, it was not male centric, it was always female centric infertility. Tubes are blocked. If you open and try to do an open surgery, do the repair of the tubes, but cocks, we can't help. The woman goes crying. That is where we started actually. When I got into practice, believe me, we could never get any hormone investigations done. It was not available. See, then came slowly the private sector came in, they started doing the hormones, and my passion for infertility never went. All the time I was practicing with whatever little resources we have, I always practiced and learned laparoscopy because laparoscopy was just beginning in 76. We were doing ligations. Slowly, we were looking into that and working, and then came the video monitoring. I've gone through all those steps. Imagine looking like that and doing, then coming to the video and video laparoscopy. Then came 90s. When 78, the first baby born, naturally the IVF, started picking up. And I was very curious how to go about it because I always was working on infertility. So what I went to Bristol and got trained for IVF. And those days, resources, human resources, hardly any embryologist. Embryologists were few. I never learned embryology. I was working on the clinician side. So to get an embryologist working, so many things. Fortunately, there were some PhDs who were working in the university who were, and what was more was there was no law. And that always, worried me. When I bought my IVF unit, I went to the government of India, the local body who gives us permission for nursing home or hospital that give me permission for my IVF. Believe me, Nina, they said there's nothing like that. Why are you getting involved? I said I don't want to run anything without a permission. I have The number one was my registration. I forced them, give me a permission to do it. They gave me one as IVF. So that is how we got evolved. And if you ask me, we started, what was the basic IVF? We used to do gonadotropin, ovum pickup, and what the embryos form, you transfer. That was the original IVF. Then came some landmark things. The first one was ICSI. Once it came, it was a giant leap. Then came cryopreservation. Initially, it was slow cryofreezing. I worked with that also. Again, another giant leap was vitrification. So that came in. All this happened in front of me. Coming to slow freezing, then to vitrification, then a whole lot of things. Sperm selection, oocyte selection, embryo selection. Now we are at AI, which does these things for us.
So truly, you've given us a life cycle of how we moved. I think to a lot of young viewers, I think very few compassionate people who are so driven and who are so persistent. Would I think there is something what you define a genius, and I think you are one because a genius never gives up. And I think that's the spirit with the genius in you that drove you. And I think the number one proved so lucky for you that we feel proud that you were the first. So this is
Yes.
again a news to me that Madam got the first registration for an IVF unit in the country. Bravo, that's brilliant. So I think let's hear more from you, from your experience. Now that you've seen that, there is a change in our patient profile, and you can
Yeah.
be the best person to describe us. How do you perceive the change in the clients or the women or the couple who are coming? You've given us a true picture of how it'll be women who were at the center of all the ostracization at all the, she's
Yeah.
been stigmatized. And now we have moved. So how do you perceive how the patient and the couples over the years have changed?
Now the patient, initially it was a sort of a stigma. It was very difficult to convince a person for IVF. No, no, that's the last thing to do. That is the last thing to do. But now more and more people are accepting. That is one. Second, as I told you before, it was always female centric before. Now the male has started realizing it. And the male infertility has been going down steadily. What we used to find in our younger days as 120 million, 80 million, we hardly find very few people. So it has become male centric. And somehow male infertility has also become more. On top of it, other abuses, alcohol, smoking, drug abuse, these things have also become more common. So we have got a set of patients. Yes, then we have got a set of patients who are now it's all media driven. So there is a lot of patients who Google a lot of things and they come and ask us, why don't you do this thing? Why don't you do PRP? Why don't you do stem cell? So we get a lot sort of a wide variety of patients. Those who are in the village who doesn't understand anything. Then there's another spectrum. You and me are practicing in metro cities. They are all educated people who come to us. They ask for all the modern things. They read about it. So we have a wide spectrum of patients. And now at least awareness is there. And they ask for new things also. And it makes me happy that our people are getting educated. That's what
So
I
I would,
would say.
that's why say would say that now we are not driven by what we tell. It's the patients coming and teaching us through their Dr. Googles that we go. But there's another thing that I would like to see. I think when you started practice, you would see many more younger women come. How do
Yeah.
you see women today? Because we are driven by our choices, by the career choices, by our economic, stability that women see once they see their careers surging ahead. And how do you see the kind of age differences at which women are coming? So do you feel that also bothers you, or you feel that is a cause of concern to all of us who are providing services to our couples?
Definitely, because I practice near university area. All of them, most of the professors and all that, career driven. They have to do their PhD. They have to do their this thing. So by the time they get up, it's already 36 years. So also so many software engineers, not only career driven. One is career driven. Second is they all want financial stability. So they want that the finances should be all right for me to produce a child. Previously, in one room, 9 children are growing. It is not like that. They want that each child should have the best of the upbringing, best of the education. So they keep postponing it. And by the time, as you know, you are in such a prestigious institute, the ovarian reserve is going down as such. You find many young patients with poor reserve. So by the time they're 36, 38, the reserve has gone down. So that takes us to another level that we should make them aware of freezing the eggs, which is very good now. No problem. So younger the eggs, better the result.
So I think you really pointed out, now women are focusing their lives around their careers. Earlier, they were focusing around their families. And I think we were blessed to have that kind of a patient clientele or our patient groups who came to us younger. And I think in the last 10 years, or the last decade, we've seen the sea shift. I think you've totally given us the right information. Again, you said, ma'am, that we have now seen more and more IVF unit come up. So when you see such a big number of IVF units coming, each striving to be the best, where do you see the affordability factor and the accessibility factor? Do you think we are still meeting? Because if you look at the Western figures, the number of IVF cycles or the number of IVF units per million population is far below what is there in European countries. I mean,
Yeah.
if I look at data, they're close to 4,000, IVF cycles available per million as compared to a few hundred, opportunities that are available, maybe 700 and something, 27 precisely per million. But still there is a need. How do you see this coming up? Do you think that it's it's a boon to have more clinics, or you see, no, we need to sort of grow into other towns other than metros also?
Yeah, that is very true. Nina, when I was the president, I was always telling outreach. Why? Because they're all concentrating on the metro cities. Okay, there are some in the first tier cities. What is happening in the second tier? Very few. Third tier, there's nothing. Villages, nothing. From villages, for a semen analysis, they have to travel 50 miles. So we have to go outreach, and maybe what Netherlands did in the initial days, we should have one central lab, and people can come in, get it done. These days are all telemedicine also, so we can counsel them, and they can come so that we don't waste their time. We can give them a proper advice, and then they can come and get it done. This will come. I don't know with the type of media we are also progressing. When whether it will come in my time, I don't know, but I'm sure in your time it will come.
That's very optimistic. We should see it in your time. Why should I say we'll wait? Now, there's a nice thing which you said that earlier, that was women centric. Now it's couple centric. With so many years of experience, and you receive patients from across North India. I know you get it from not just tier one, you get it from tier three, and the smaller towns and even villages. Where do you see the affordability today? I mean, now that we see that we are a growing country where our prosperity levels and economy, they say, one of the fastest growing economy. So where do you see the affordability coming up, and how many do you think have improved on this aspect, as you
See,
saw earlier?
that is one part. I think we will have to do a little more in the sense many of the insurances do not cover. Government agencies cover partly. We how much of a percentage are really affording? 1% are the really. So if what is the statistics? I forget. So many million people need IVF, out of which hardly 10% are affording. So this is a problem. So how to solve it? This is you are, as Dr. Sunita said, you are a think tank sitting at Ames. We will have to see how we can make it more affordable. See, for us, the thing is, most of our media, most of our pickup needles, transfer catheter, they are all coming from outside, or we import them. So it is expensive. If we can make it made in India, it becomes much cheaper. So when we reach that stage, I'm sure it will become more and more affordable to people. Another thing is all these that we take, we use it once and throw away. Like cardiac catheters, now they are recycling.
Exactly.
Right? If we can recycle, again the cost will come. But I don't know when, if we can do it, unless someone does an RCT, one can't say.
Absolutely. I think these are some of your novel thoughts, and I think they are not thoughts, they can be put into action. But I think there are companies in Bangalore and Hyderabad who already started as startups and are doing their media in India. And I know that from the way we can progress, India has obviously got a lot of genius, a lot of minds put together. We can move IVF from the very elite to the common man's reach. Because I think I think over 30 million suffer from infertility. And if 10% make it, I think we need to give it to many more. So that's
Yes.
really amazing. Again, ma'am, you have seen, as you described, that there were hardly any ultrasounds. You hardly had media. Today, you see that technology is there at the click of a finger. You can order anything. If a new, app is launched, a new, media comes in, a new incubator is launched in Europe, Eshrei launches, and the next year it is in India. So you can see the shift that you have seen. So how have you seen, and how do you perceive the technology evolution? How has it helped your practice, or you think the RT world? How have you been eased with this in terms of?
Yes. We are one of the few lucky ones who's sitting in a metro city who has access to everything. And I would say, let us take one by one. In male infertility, we have gone to higher technologies. You have, let us say like this, better sperm selection, better oocyte selection, better embryo selection. For everything, we have this thing. To select an embryo, time lapse technology, many people have it. For sperm, you have ICSI, PICSI, IMSI, so many things. With the PICSI, IMSI, you are selecting the sperm. Microfluidics have come. We are all working with all this to get the best sperm that is. Then after that, you have as that PGTA, you can use the, you know, euploid embryo, put it, your results are much better, right? We have gone from just day 3 embryos, now we have shifted to blast. So many advancement, because this is still an evolving science. So many new things come up. So it's an evolving science. There's no end to knowledge.
Absolutely. You rightly brought out all the changes. And I would truly say that, when I was reading up, it took 102 embryos to be put by the group of Edwards and Steptoe and Purdy, Jane Purdy, to get one Louis Brown. So, they struggle. So today, I think we don't have to wait for 102 embryos to be forming to give. I think, so how do you perceive that this has moved up? If you looked at success rate in the early 80s, best centers would give you a success rate of just maybe 10-12%, and today look how they're quoting.
That was what they used to quote. Now, see, one thing is there, in spite of all this, in a fresh transfer with the this thing, still we haven't crossed 35 to 40%. But we are able to freeze the embryo, because now we are going mostly for a single embryo transfer, so that you reduce the twinning rate. Now, if we are going to, again, the same batch of embryos, if you do a second transfer and a third transfer, we are getting about 60 to 70% results. Very few go away, doctor, why is not happening? We have so much of investigation to see why there is recurrent implantation failure. Then we check it out. We have so many investigations. We try everything that is possible so that the person gets a baby. And we always manage it, except for a small. Maybe we will struggle a little bit, maybe 3 times, 4 times. We try manage it. But of course, 10 to 20% are there. Whatever you do, they don't conceive. One's inherent luck is also there, which you and me cannot change. Right?
That's true.
Yeah.
Absolutely right. So I would say with the new technology coming, I think cumulative birth rates or cumulative live birth rates have really improved.
Gone.
So to tell our viewers, we have clinicians who do infertility in IVF. Dr. Gauri is one of the exceptional holistic clinician who just doesn't see couples, but also carries the women with her in her unit as an obstetrician, and she's well known for her obstetric unit. So I think we're one of the rare combinations who is not just an excellent IVF specialist, but an excellent obstetrician. So, in your practice as an obstetrician, I would just drift a little. How do you perceive these IVF babies come and the IVF pregnancies? I know they are precious. Every baby is precious, but in your experience, how do you see that it matters? Yes, the couple is very anxious, certainly,
The
but
thing is, they're anxious, and as you rightly said, they come in the later years. So they have their own problems. Like elderly people come, they have hypertension, they have diabetes, twins or triplets. That itself is a problem for them. So these and they're very anxious because some have tried 3 times, some have tried 2 times, some are already been infertile for 10 years or 15 years. So they are very anxious, and we as obstetrician, we are also tense because if something goes wrong with the baby, something goes wrong with the mother, we are responsible for it. So we really work hard towards it, that how best to give a best outcome, right? And many a time, you have the advantage of being in the premier institute. We work in small hospitals, so we have our own problems, a very good neonatal unit. So we try to see which is the nearest good neonatal unit, so that we have contact with them. Any problem, shift the baby so that the baby doesn't have any. So these things are there with that, but yes, we still manage.
yeah, I know we do understand that these babies run the risk of prematurity, which is really, we keep our fingers crossed. FGR, all these things are there, and especially as you rightly pointed out, pregnancy is certainly complicated. But then I would just put it here. While our patient and our couple profile has changed, how do you perceive the expectations of patients, maybe in the early 90s to today? Because, as our couples are more well informed, how do you see a change in the expectations of the
Oh,
patients
that
today?
is terrible if you ask me, in the sense, in 90s and all, no, they will say, okay, it is our luck that we haven't got it. Now it is not like that. Why is that I have this problem? Why is that my baby has this problem? I've been getting ultrasounds done every time you're told. Why haven't they diagnosed it? There are certain things you cannot. See, there are certain things you cannot, imaging may not tell us. Once the baby is born, we come to know. Autism, it is coming uh, they're all late pregnancies. Number one, the elderlies have more chance of having autistic babies. Then they become very perturbed because once they have one autistic baby, they are even scared of producing another one. And autism as such in India, I don't know about other cities. Delhi, we still do not have a very organized setup to treat these babies. That's also needed.
You've really touched the issue so rightly. I think autism is on the rise, or maybe we have better ways to judge them. But you rightly pointed, it is not the mother's age, but it's also the paternal age, because we're seeing advanced age at which men are coming, and advanced paternal age also is contributing to
Yeah,
autism. And you're right, our environment and our society is not so geared up to
yeah.
handle, and therefore
This, you
that's
see, that is the thing.
that is.
We have to gear up for that also.
So I again would come to a little more of, your experiences, because we've had the ART bill come in 2020 and 2021. You all are there. So how do you see your practice, and what shift do you see with the ART? There are boons, there are, downsides of things, and everything realistically is a lot of compliances now. So how do you see the practice or the evolution of in the last 5 years with this ART bill in place? Has it affected your, provision of providing help to couples? Where do you feel?
Nina, actually, I think this ART law is a boon, if you ask me. Yes, we are, as I told you, as we are evolving in the subject, even the law is evolving. They made initially something, then it didn't come to the table, then it was revised, then people like you are there in the board. So slowly, slowly, I'm sure it'll come to a perfect this thing. They're also trying to learn. They do not have know the nuances of the things unless we people, the societies, people like institutionalized people like you, telling them, they will evolve, and it is actually a good thing. It protects you. You have a law straight away laid out. We can always tell the patient, look, this is allowed by law, this is not allowed by law. Tell them straight what is there. Though there are people who went to court, got the permission, right? Got the
That's right.
permission. I'm in a soup in one patient because of this, because they are telling you do the surrogacy, and they have got a court order for that. So court order they've come with. I said, okay. And when you approach the PCP entity, they say, don't touch it, don't touch it.
Yeah.
I said, they again brought a court order telling whatever way you give them a child. I don't know. I said,
You're
okay.
right, you'll have lots of stories to share, but I think you rightly said we should see the positive side of the bill because it is actually not policing the doctors, but also policing the patients who are too demanding and forcing you to do something which is not lawfully or
It is,
rightfully the way we should do it.
yeah,
Absolutely pointed out. So I think I would just say that, again, you said women are delaying marriages, they're delaying childbearing career. We are seeing a lot of advanced women, advancing age and advanced maternal ages, AMA as they call it. So a lot of new add-ons, new rejuvenating the ovaries, newer things like PRP, stem cells. In your practice, I know you are a very ethical, and as I would say, look up to your practice in a very, righteous way you do. Where do you see these add-ons, or where do you find them as just gimmicks, or you see, no, they have a future. They may not be today, but in the coming, few years, they will have a way forward for
I'm
our
sure,
women.
Nina, what we thought 10 years ago not possible is possible today. Same way, I'm sure even PRP, you have worked with it, I have worked with it. We have found success coming up, endometrial thickness going up. Some of the things may not work, like ovarian rejuvenation with PRP. How much is this useful? We do not know. But endometrial thickness in RIF, we have found it useful. Maybe with the time to come, now they have started activating the platelets. So there will be methodologies which will come and which will help us. Nothing is, we can't say this will not work in future. The stem cells, so much of research is going on. So I'm sure they will come out with something. Even your own institute, yeah, they have, Nita Singh has published that on stem cells. You are doing so much of work. So I'm sure we will come up with things in future.
And as you rightly said, we have to evolve with technology. You have to be accepting it because in the initially phase, we know that we are hit and trial because in our field, there are not much ways of doing randomized trials because there is no scope of, putting that kind. It's all intense on cost. So I think our bit has to be hit and trial, run for some of our, techniques, learn from our mistakes, and then, put
Yeah.
it up. So I think you really, really covered the subject so beautifully. But I won't leave you. I think we've talked more than 40 minutes, I realized, and we've been getting our time there. But there's a lot of, incentive which our youngsters see in reproductive medicine, and why not? There is a big need for, talent to come on the field of on this aspect of clinicians. We need talented pool of embryologists, even though AI may come, the human brain is needed. So a lot of youngsters are aspiring to, look up to reproductive medicine. So there are a few questions that I would really ask you. And one of my favorites is, what do you think would be your advice to the youngsters who are looking up to reproductive medicine as a specialty, a super specialty? And where do you see they should sort of invest in their focus in terms of their
See,
abilities?
I would tell them that number one, everything is doable. You keep working at it. Number one. Number two, there is no substitute to hard work. And if you have the determination to learn a thing, one will do it. So you should have the passion to do it and work for it. And I have never worked for anything for just financial retribution. Be sincere to the patient, be sincere to yourself, even as a practitioner. You will always have financial remuneration, one nothing to worry. But I would always tell them, just don't work just for money. Be sincere to the patient. Be sincere to yourself. Your work will be perfect. And always learn new things. This this particular branch of medicine is progressing. Even now, it is evolving. So one has to be updated. You can't do that. What I've learned 5 years or 10 years ago, if you just keep sitting with that, you will be way behind. So one should be hardworking. One should keep updating yourself with what the latest knowledge is, and work for toward the betterment of the patient within the law guidance. Don't go out of it. Don't do any slip shots for money or anything. People will try to tell you, please, doctor, do it for me. But no one protects us. So always within the law, one will be successful. That's what I would say.
But really, I think you are given the mantras to strive for excellence. That's the way I would look. But I won't leave you here. Something. I know you are the role model and you really mentored so many. I think you've produced not a factory, but a cohort of trainees who are under you. And I think generations of students who are trained under you and have taken, their way forward in obstetrics across the globe. You have your fans and your patients. Now, when people look up to you, can I ask you, whom do you look up to? Who has been your role model? Because that's what I want to hear. Because um, we want to always hear from our guest. How did they have in their journeys, some milestones, some landmarks which left a mark? But I would want to ask somebody who inspired you and you looked up and followed.
See, this is not any person who inspired me. It was a sort of a determination, I would say. I was very mathematical wizard when I was a student, and I wanted to take up mathematics. So my mother was wanting that I should become a doctor, and I scored 100% in mathematics those days, and a distinction in physics. So the principal, when I got into medical college, principal asked me, why didn't you go to engineering? So I said, my brother is an engineer. He says, don't come here because it's not for women. Because he had in his class, he was a mechanical engineering student. He says, girls cry because they can't do. So it was by this thing that I entered medicine. I never regretted it. I never looked back. It is not that any one person has inspired me. I liked medicine. I liked gynae ops because when I was doing my internship, I decided I'm going to do gynae ops. Everybody was telling it so tough, this and that. I said, no, this is one branch where I can practice medicine and surgery both. That was my outlook. Then the whole of infertility journey I told you, and in that journey, I forgot to mention in this thing. One of the latest thing was fertility preservation. So once I was doing this, I entered fertility preservation also because that was the latest that was coming. So it was not that one person, but on the way, you pick up so many things. My guru was Dr. Pankajam from P. Pankajam, who did who was my professor and guide in Safdarjung Hospital. And from there, when I started practicing, I was on my own. There was no one to guide me. So I wouldn't say one person guided me. It was that I learned from so many people. Every meeting I would attend, every CME I would attend. So many people slowly entered, in my this thing that this is correct, this is not right. But ethical, I had always been. That is my core.
I would totally agree to everything, but I think somewhere you're sort of missing on something. I think where would you put Dr. Yeah, how can you say that no, you could never look down? I think Dr. Chandra Prakash, if he's going to watch and hear this podcast, will never accept because I'm not accepting it. So you have to come out honestly. And I know he is your anchor, he is your role model. So how can you not mention in this podcast? Would like to hear about him, your better half.
Encouraged. See, never that way I was lucky. From the time I'm coming, those times male were very, very. I wouldn't say they didn't encourage women to become. Even now, you see software engineers coming and telling me the women that my husband doesn't want me to work. I have an MA PhD PhD in mathematics. She's sitting at home because the husband doesn't want her to work. So that way I was lucky. He always encouraged me, even, otherwise, how would I have done? I had two children to bring up the children and then do all this work in private. In private, one is alone. So all this work in private, he always encouraged me till date. When I hesitate, should I take this up? He says, no, do it. So I wouldn't call it role model, but I would say he was a great support.
Inspiration. Let's put it in the right words. I'm sure I, I have to put these words, but I can say I see him as an inspiration, not just to you, to many of us, at his brainwaves as he's so sharp. So I think it has been a pleasure talking. I think we both can go on for maybe an hour and so and get the best. So it has been wonderful to have you, ma'am, on the podcast. And I think it has been long waited, I would honestly say. And to my viewers, we've been playing hide and seek. It's been for 4 or 5,
Yeah.
months. And every time it was a 10th, madam would be busy. And I know that she is a busy lady, but I'm so grateful to her that despite her busy schedule, she has given me this 10th, for the last of the year, on the 10th of December, the opportunity to capture her time, and give us the opportunity. So thank you so much, ma'am, for being on this podcast. You really, really done me a lot of good. And I think all our viewers are going to thoroughly enjoy this podcast of
Thank
yours.
you, Dr.
Thank you
Nina.
very much. Thank you so much. Thank
And
you.
a very happy New Year 26 to all the viewers.
Yes. Thank you so much, ma'am. Thank
Thank
you.